ADD and ADHD consists of a persistent pattern of inattention and/or hyperactivity that impacts one's life. Typically, these symptoms persist for at least 6 months. The inattentive part of ADD includes some or all of the following: careless mistakes or not paying attention to detail, difficulty sustaining attention in tasks, does not seem to be listening to people who are spoken to directly, and I'm sure many wives can say this about their husbands, often does not follow through on instructions, and fails to finish assignments or tasks, has difficulty organizing tasks and activities, avoids or does not like to start something that requires sustained mental effort, often loses things necessary for tasks or activities, is easily distracted, is easily forgetful. For the hyperactive or impulsive type, it looks a little bit differently. Someone may fidget or tap their hands and feet frequently. They may leave their seat in situations which require sustained seating. They may be running or climbing around in situations that are not appropriate. Unable to play or engage in leisure activities quietly, often feels the need to be on the go or driven by a motor, often talks excessively, often blurts out answers before the question is being completed, often has difficulty waiting his or her turn, such as in line, and often interrupts or intrudes on others. For children, the symptoms usually start presenting themselves before the age of 12 and needs to be diagnosed in 2 or more settings, such as home, and activities or with other relatives. People diagnosed with ADHD are at higher risk for learning difficulties, academic problems, also psychiatric conditions such as mood disorders, anxiety disorders, substance abuse problems. Studies suggest that influencing the metabolism of dopamine can be the culprit in why people develop ADD or ADHD. There are also studies done by scanning the brain waves of children diagnosed with ADHD, and these children had both the combination of the inattentive and hyperactive types, and they had slower beta brain waves on the EEG scan, and they were also more likely to have mood swings and temper tantrums. Interestingly, children who are more on the hyperactive subtype are more likely to get in treatment, as these symptoms are more likely to be at the attention of other people, whereas children that are more the inattentive subtype are less likely to get involved with treatment early on. It's thought that the biochemical issue at playing a role in ADD or ADHD is the dopamine molecule. And it's thought that the dopamine flowing through the frontal cortex plays a role, because the frontal cortex deals with planning, organization, focusing, sustained attention. A lot of tasks or a lot of the function that is seen as off kilter in ADD and ADHD. So the medications that are commonly used nowadays target dopamine and probably help regulate dopamine flow to the frontal cortex and the rest of the brain. Some of the medications include Vyvanse, Adderall, Bupropion, Ritalin. A lot of these medications I've talked about in previous videos. Most of these medications are approved in children, but antidepressants like Bupropion just have not been well studied in children yet, so may not be recommended to use at this time. So the main caution when using stimulants is particularly in people with a history of heart disease or heart condition, because it can increase the chance of a heart attack or heart arrhythmia. There are some other medications that may help with the hyperactivity or impulsivity. Those include Clonidine and Guanfacine. I see this more commonly prescribed in children, but it can also be helpful in adults. Speaking of adults, ADD and ADHD can occur in adults because oftentimes people may live through the symptoms or the struggles that this disorder provides, but still are able to function in life. But when they get to adulthood, there's more responsibilities in their life, and these symptoms may more likely manifest itself. Also, it can be more common in people who have a history of head trauma, such as like loss of consciousness or head injury from playing sports, or a fall or an accident. They can more likely develop ADD or ADHD than the general population. For the most part, treatment approach is the same.